teams. Yeah. So how many doctors are there in this team? One. Only one. No? So one team will have an advantage of having a doctor. So I think kiti local it is 9 na? So first 5 people come inside. Yeah. So what we are going to do is we are going to do a real time scenario. Yeah? Assume as this is a real patient, real life scenario, and you have to act accordingly. So currently the learning point for this skill session is you have already had scenario where you have managed the patient with VFAD. Yeah? But here we are going to have a team concept. Yeah? So there will be a team leader, there will be directed instructions to team members. Yeah? The team leader's responsibility, roles and responsibilities are very clear. You must have seen in the lecture. He has to give directed instructions, he has to see that things are done well, he has to do the thinking part. As the team members have to concentrate on the individual skills. Yeah? So in this manner we can know the skill part also. So we are going to comprehensively look at this. So 3 things about communication. One is clear goals and clear directions. Yeah? The other is call back. If the team leader says you that get adrenaline. Yeah? So you should be clear how much adrenaline, what dose. Yeah? So there should be a clear closed loop communication. If he says adrenaline 1 milligram, you have to say, Weber, I am going to give adrenaline 1 milligram for the 20 ml flush, adrenaline given. Yeah? So that the things are done, the team leader knows that. Yeah? You have to concentrate, the team members have to concentrate on the individual skills. Yeah? So it's a real time scenario. Yeah? We all have got the sheets with you. So basically a 62-year-old male who has been brought into the EMD with chest pain. Yeah? He's complaining of chest pain for the last 45 minutes with profuse sweating. Okay, and I have these 5 members. Okay, so Umer will, sorry, what's your name? Akshay will be team leader. Yeah, but he will pitch in later on. Yeah. So anybody of you work in EMD? You come. You are the first responder. Okay. So EMD person is the first responder. Is going to assess the patient and is going to do initial actions. Okay. बाबा तू एमडी मध्ये आहेस, तुझ्याकडे चष्म्याचा पेशंट येत असतो, तू कसं मॅनेज करणार आहेस, पेन चष्म्याचा पेशंट आल्यावर तू काय काय करणार आहेस ते सगळं करायचं तुला. ठीक आहे. आणि डॉक्टर म्हणून अक्षय येणार आहे. ठीक आहे. चल
सिनेरियो पता चला ना क्या है सिनेरियो? चेस्ट डिस्कम्फर्ट.
वैभव खूप दुखतंय मला, मागच्या अर्धा 1 तास झाला खूप दुखतंय डॉक्टर, काहीतरी करा. मला खूप अस्वस्थ वाटतंय, मला खूप अस्वस्थ वाटतंय, काहीतरी करा डॉक्टर.
काका काय होतंय? कुठे दुखतंय काका?
दुखायला लागलंय, डोळ्यासमोर अंधारी येते, छातीत सगळीकडे दुखतंय, छातीत अस्वस्थ वाटतंय मला खूपच.
आकाश सर, चेस्ट पेनचं पेशंट आहे. आकाश सर, क्रॅश कार्ड घ्या.
हटायचं मॉनिटर.
तुझं क्रॅश कार्ड घ्या म्हणणार ना, कोणाच्या नावाने बोलव. तुझे अक्षय आहे.
अक्षय क्रॅश कार्ड घे.
हटायचं मॉनिटर 10-12 ECG.
LED ECG machine is coming. Okay. See what are construction meter?
Put Watson mask.
When we start the routine with the paddle, the paddle साबित लगाने तक
Put Watson mask.
BP reading. खूप दुखतं डॉक्टर, मला काहीतरी द्या. हे काय लावलं चेहऱ्यावर? मला श्वासाला त्रास होतो, मला दुखतंय खूपच.
काका तुम्हाला दम लागू नये म्हणून लावले, थोडं श्वास घ्या.
दम काय लागत आहे, मला दुखणं कमी करा बस, मला दुखणं कमी करा बस.
Secure IV lines. Start IV.
Secure IV lines.
आता नाही सहन होत, करा डॉक्टर काहीतरी. ECG मशीन अंदर दे. दुखते खूपच. डॉक्टर कुठे? डॉक्टर कुठे?
Start CPR. Count.
डॉक्टर काय झालं आमच्या पेशंटला? काय करता तुम्ही? डॉक्टर काय करता तुम्ही आमच्या पेशंटला? काय झालं? काय झालं बाबा? बाबा उठा बाबा. बाबा काय झालं? काय झालं डॉक्टर? काय झालं डॉक्टर? काय झालं बाबांना?
Clear.
Okay, we stop here. Yeah? Okay, just keep it here like this. I believe you should keep it inside. Okay, chalo. So first responder was Vaibhav. बरोबर ना? हाँ? So a patient comes to you with chest pain. तू काय करणार पहिले?
विचारणार पुढे
हाँ, chest pain होते. So the first thing he did well, na? He asked patient what his symptom was, and he realized that the patient having chest pain. He immediately called in doctor for chest pain. The next step what you did?
मॉनिटर
Yes, you have to connect a monitor. So you started putting on the monitor. So I helped you because this is the monitor. So ECG, you saw the rhythm initially, ECG rhythm. Yeah, what are the initial vitals? So I started the blood pressure also. Blood pressure is
प्रेशर चेस्ट लीड
Okay, so you connected the chest lead, you looked at the pulse oximeter, and you looked at the ECG and the blood pressure. So it seemed to be stable for to you initially. Yeah? Then you were wondering what to do. Yeah, meanwhile, doctor came. Okay, what was your first response? He has already told you that the patient is having a chest pain. So he said, let's do a 12 ECG. And that's correct. And you realized that the saturation was 92. So you asked him to put on the oxygen. Yeah, it's always a good idea to tell patient that what you are going to do, what intention you are going to do. Yeah? Otherwise, he will be very anxious. He will feel what these people are doing. I am having a chest pain and asking for painkiller. Okay. The next step was the blood pressure was 110 or 45. Was anti-G a good choice for chest pain? Yeah? So maybe not initially. Yeah? You would have probably done an ECG, ruled out the 12 lead ECG instead of an MI. Yeah? With this blood pressure will crash further with NTG. He was trying to get the NTG infusion. Yeah? Meanwhile, what all things he said towards the end that you have to load the patient. Yeah? So chest pain patient, what we usually do is we load with medication. So that is about the theoretical part, technical part. Yeah? Now here what happens is that when he says NTG, yeah? So if you are sure that in the crash card where the NTG is, you should find out. If you are not sure, you should ask for help. Yeah? Rather than trying to, in an emergency, we should know what all things are there in the crash card. So you should have asked for help. Yeah? Rather than trying to open things and find out where the NTG is, you should have asked for help. Yeah? Okay. Then what happened? The patient was wincing in pain, was moaning. Yeah? He suddenly became listless, unresponsive. And what did he realize?
Check for pulse.
Did you saw something on the monitor? You saw something on the monitor. You saw on the, is it a flat line?
No, not pulse is.
So the rhythm was initially stable rhythm, yeah? But you realize that there's some change in rhythm, yeah? And he's probably not breathing. So what did you ask him to do? Start compression. That was a good thing. So the first thing to do is when the patient is unresponsive is to check the pulse. Pulse should be checked properly, yeah? In this manner you can really check the pulse, yeah? If the pulse is not present, you should ask by name to give compression. So who gave compression? Akshay. Akshay's compression was better. Yeah? So the depth was good and the relaxation was good. Okay. Then after 30 compressions, 2 breaths. This was going on well because you have practiced only recently. Okay. Then if he was here only at the bedside.
So we check for the pulse.
So you decided that you are going to check for rhythm. But the rhythm was seen on the monitor, no? Yeah. You saw the rhythm change on the monitor. This rhythm, what is this rhythm? It's a fibrillation. Yeah? So then you had a defibrillator and you are holding a defibrillator in your hands and waiting like this till they were giving compressions. So this is a witness arrest or not witness arrest? It's a witness arrest. So in a witness arrest, the first thing to do is defibrillation. Yeah? So you took the defibrillator. They completed 3 cycles. I said 30:2 to 30:2. They were doing it well. He was doing 30 compressions. He was doing 2 breaths. Immediately he was resuming compressions. So that 30:2 you are doing very well. Huh? You must have realized that they are doing it well. Yeah? So was the defibrillation earlier defibrillation required? Should you have waited for 3 cycles and then thought about checking the rhythm, or should have said, okay, you start compressions, I'm going to check the rhythm. Yeah? Okay, let me confirm the rhythm. Rhythm is shockable, stay clear. Okay. And what happened when you are trying to check the rhythm? When you try to check the rhythm, why the rhythm was not seen, right? So when you on the defibrillator, yeah, so it will be off. Yeah? When you on it, you have to always keep the paddles in place. Yeah? Okay. Now if you are going to check your rhythm using paddles, what you have to do is, this is on lead mode by default. So to change it to paddle mode. Yeah? Now check out the paddles and now check the rhythm. Okay? Yes. Yeah? So you didn't saw the rhythm because it was on the lead mode. You have to change it to paddle mode. This is a very important step for defibrillation. Okay? Then
Charge the.
yeah, charge to. So he did a. See, when you're a team leader, ideally you should not do any task like defibrillation. But you felt that the team is new. Yeah, you are better positioned to do defibrillation. You can take over the defibrillation. Okay. Yeah? So once you have checked the rhythm, you put the paddles back. Yeah, you will continue compressions. You will charge to what? Suppose he is giving defibrillation. Yeah, you come. Omkar na? Omkar is going to give defibrillation. You have to give him instructions. Yeah? Okay. He is absolutely new. Yeah? Okay, tell him what all things to do in defibrillation.
Start the defibrillator and 200 joules. Rotate the 200 joules. Rotate sir. And charge. Press 2. See, when it came 200 joules, then I have to put 1 pad there and 1 pad here. Like half. 1 pad here and 1 pad here. See, all clear?
All clear.
You shock.
You clear. Shock D.
And after that?
Start compression. Start compression.
Okay. So, ओमकार तू करत असताना शॉक ना तू ऑलरेडी जरी म्हटलं तरी मागे वळून बघायचं की मागे कोणी टच करत नाही ना ठीक आहे ओके So after the first shock, what is the drug which is to be given? You already have an IV access in place, no? Adrenaline. After the first shock or second shock? After the first shock. After the first shock, usually an IV access is secured. Now this patient already had an IV access. Meanwhile, you are stabilizing him, putting on monitors. Okay. ठीक है. So next team. Next team. उनके पास ही रहने दे वो करेक्ट मत कर नहीं नहीं So the second team, you have seen the first team. You have already practiced the Vidyapeeth algorithm. Okay. So this is a patient who had come to you with chest pain in the EMD, and you have to assign your team. Who is going to be team leader here? Huh? Bad demand. तेरा नाम आ गया, चल ठीक है. हाँ? So he is the team leader. Who is going to be a first responder? Who wants to be first responder? कुछ नहीं था. चलो आजा. So the scenario is the same. He comes to EMD with chest pain. Yeah, you have to assess him. Yeah, and you have to take appropriate steps. Don't presume that the patient is in cardiac arrest. You have to do proper evaluation, proper assessment. Yeah, चलो आ जाओ. So he's come to EMD with chest pain. Huh? He's been just wheeled in, yeah, on a stretcher from his own car, and he is complaining of chest pain. Okay. No, you have to talk to him. He's complaining of chest pain. He's saying I'm getting severe pain. Okay.
भैया
हाँ,
किधर है दुख?
छाती में दर्द हो रहा है.
डॉक्टर
पिछले आधे घंटे से छाती में दर्द हो रहा है.
डॉक्टर
बाबा काय होतंय? काय होतंय? कुठं होतंय? इथं त्या साईडला. ऐका ना सिस्टर. ऐकू नाही ना. डॉक्टरांना सांगा की पेशंटला चेस्ट पेन होतंय. कुठं होतंय बाबा चेस्ट पेन? दम लागतो तुम्हाला?
छाती में काम नाही आहे.
उठू नका.
मी फुटबॉल खेळत होतो आणि तेव्हा काय लावलंय
थांबा, ऑक्सिजन मास्क लावून तुम्हाला दम लागणार नाही आणि ठीक आहे असिस्टंट वर मेसेज घ्या, मेसेज घेऊ करू आपण.
सो ECG इथे आहे, ते डिफेक्ट ECG लीड लावले का?
बाबा थोडं थांबा, 2 मिनिटं थांबा.
डॉक्टर
सॅच्युरेशन बघा, सॅच्युरेशन किती आहे? बाबा थांबा, दम लागतोय तुम्हाला. ते मास्क काढू नका बाबा.
लागत नाहीये पण छातीत खूप दुखतंय.
थांबा 2 मिनिटं, डॉक्टर येतील.
डॉक्टर नाही का?
आहे डॉक्टर आहेत. बेसल 110 आहे सर. बेसल पण ठीक आहे. ECG घ्या. बाबा थांबा, दम लागतोय. बेसल को बोलतोय पेशंट हायपोक्सी हो रहा है बहुत.
एबीजी भी चल.
रुको.
बीपी
चेक कर. एनआयडी लावले मला.
हो बाबा थांबा. डॉक्टर थांबा.
दुखतंय हो. हात कडक होतोय.
थांबा.
दुखतंय मला, छाती दुखतंय हो.
बाबा
काहीतरी औषध द्या, छाती दुखतंय. डॉक्टर कुठे हो?
पेशंट अनरेस्पॉन्सिव हो रहा है.
काय करताय? डॉक्टर गळा काय दाबताय? डॉक्टर गळा काय दाबताय? काय छाती दाबताय हो? काय करताय? नका दाबू छातीत, नका दाबू छातीत. काय करताय? काय करता डॉक्टर? दुखते छातीत आणि तुम्ही दाबताय छातीत. डॉक्टर छाती दुखते. काय करताय तुम्ही? ECG मशीन ऑन द वे. डॉक्टर छाती दुखते. डॉक्टर काय करताय? डॉक्टर काय करताय?
कौन से 100% सैचुरेशन उसका
ये दोनों मत बोलो रे. डॉक्टर आता खूपच अस्वस्थ वाटायला लागले. मला वाटतं मी जातोय. डॉक्टर
कसं नाही होते बाबा.
डॉक्टर दुखतंय ना.
औषध देते.
डॉक्टर दुखतंय. 2 तास झाले दुखतंय.
बाबा थांबा.
सैचुरेशन लो.
कफ निकाला का परफेक्ट निकाला
Check the pulse and start.
5 seconds.
Start CPR. Monitor on. Continue CPR.
Okay, stop. Stop. So, आ जाओ टीम आ जाओ इधर से आ जाओ. So can you just tell me what all things happened? And how did you manage this patient? So you are the first responder. Patient come with chest pain. Okay. So you asked him कि किधर दुख रहा है. So he said कि hurting in his chest. Meanwhile he also came. Deepak तू आलास ना नंतर लगेच. So Deepak asked him in his vernacular because you asked him Hindi na, so you asked him Marathi. He said the same thing. It's hurting me and I'm having a chest pain. Okay. Then there was an urgency. Yeah. Maybe you have all managed chest pain patients. There was an urgency that you have started putting an IV access, started putting an oxygen mask. Yeah. And you started putting monitor. Yeah. Okay. I have to put the monitor. So what was the initial assessment of the patient? Yeah. So who was the team leader? Yeah. So your responsibility comes as you're going to overlook scenarios. Yeah. Okay. So what was the initial impression? What was the initial heart rate of the patient? What was the initial blood pressure? What was the initial saturation? What was the initial rhythm? Was the rhythm normal sinus? Yeah. Was it a sinus tachycardia? So this was the initial rhythm. Huh? Okay. What is this rhythm? Yeah. So he had an unstable rhythm. Yeah. It is VT. And VT with he was conscious. Yeah. He was talking to you. He was telling the chest complaints. He was breathing also. His oxygen saturation was fine. Yeah. Okay. Then what happened? He was continuously complaining of chest pain. बराबर कि नहीं? Yeah. So what did you decided next to do? Okay, 12 ECG. You asked for a 12 ECG. I said the machine is on the way. It's going to take time. Yeah. What was the next thing? IV access was taken. Good. Oxygen was put to the patient. Yeah. Okay. Painkiller will be required. Okay, but probably nobody suggested. Yeah. That we should probably give him some painkiller. Okay. Then loading dose. Okay. You are not sure whether the loading dose was given or not. You can, but you would have asked. Is the loading dose given to him? Yeah. Okay. Okay, you have to escalate to cardiologist. Yeah. Meanwhile, what happened? Why was that sudden this thing of fear? What has happened with the patient? You suddenly check the pulse. Yeah. And you find that the pulse is not there. Okay. Yeah. But the patient was conscious talking to you. Yeah. You started compressions. The patient said, move away. It's hurting me. Already I had a chest pain. Okay, so the pulse check was not proper. Pulse was there that time. Yeah? So it was VT with pulse, na? Okay, and a team leader, as a team leader, you have to take all those calls. Huh? If you feel that the patient is VT with pulse, okay, then what is the next step? Probably you will require, you went to defibrillation. Huh? You went to defibrillation with an idea that patient is unstable, having chest pain, and is having a VT with pulse, and the heart rate is 180. So you may need to use a defibrillator. So that was your thought process. It was a good thought process. Huh? But what sort of defibrillation you will do in this patient with pulse? In an unstable patient with chest pain who is having a pulse, yeah? What you will do? Defibrillation or something else? With a similar machine? It should be cardioversion. He had a pulse that time. Okay, but there's a confusion. there's a lot of confusion, and I think as a team leader, you have to take a call. And if a team member feels team member outside the team, people said the patient is conscious, you don't need to shock him. Okay, you don't need to do compressions. But as a team, if you feel that at this point the patient is conscious, should we recheck the pulse properly? You should verbalize. You should say, okay, let's check the pulse again. I think he's conscious. Before starting the compression, you have to ascertain that the patient is pulseless and patient is unresponsive. Okay, that is the important thing. Yeah. Then what happened is there was change in rhythm, which you picked up. Okay, so as the rhythm changed, the patient became unresponsive, eyes closed, some sinuses, you picked up that and you started compression. That was the time the compressions were required. Yeah, that time the rhythm was changed to ventricular fibrillation from ventricular tachycardia, there was no pulse. Okay, so when there is no pulse, you start off with compression. That part was initiated well, compressions, bag mask ventilation. Okay, now at this juncture, what is required is to check the rhythm. You have a monitor, but you may need to cross-check the rhythm. Okay, so like the first team, when you started check for defibrillation, checking the rhythm, what happened? Why were you were not seeing the rhythm? So as you on the defibrillator and you took the paddles out to check the rhythm, you could not see the rhythm. What was the problem?
Leads was not connected.
Leads were not connected, that's okay. But you can check the rhythm with paddles now. In an emergency, we use the paddles to check the rhythm. So you should have changed over to paddle mode. So as you on the defibrillator, make up your mind. Are you going to use chest leads or are you going to use paddles? If you are going to use paddles, change over to paddle mode. Because if you are putting chest leads and if you are using paddles, you won't see. Okay. So paddle use करना है तो paddle mode select करना है. Paddle mode में rhythm देखना है. Then the next step comes up is you have to make sure that everybody is clear and then the defibrillation is given. Okay. Yeah. So few things, important things. One person has to give clear call. Here everybody was doing their own things in between. There was no team approach. You have to have a team approach. So in a team, you are designated Ekendra as team leader. Yeah? You have to look at him for instructions. You should not act on your own. Yeah? If you feel that he is not able to proceed further, or if you feel that you should intervene, you should say, hello Ekendra, I think now we should check the pulse and we should start compressions. Yeah? Hello Ekendra, I think this patient is having a VT, and is unstable. I think we will require a doctor for help. He may require cardioversion. So even that is important. Yeah? So this close loop communication, planning things, and the team leader has to be proactive. Yeah? He has to clearly communicate, and that should be close loop communication. If he says now he give compressions, so compressions are initiated. Okay, then team leader will see whether the compressions are adequate or not. Yeah? Okay, we didn't go to drugs, but for drugs also close loop communication is required. If a particular drug has been asked for, the person who is preparing the drug will say, do you want me to give adrenaline 1 milligram followed by 20 ml flush? Then I can say yes. Okay, then I'll load it. I'll say 1 milligram adrenaline 20 ml flush given. Okay, yeah. So that has to be a close loop communication. Yeah, and a team approach is very important. Otherwise, what happens is now somebody will be busy in airway. If I ask for drug, 2 people will go and try to get a drug out from the crash cart and stop in the compression. So compression have to be uninterrupted. Yeah? This is the entire crux. Communication both important. Okay, so team leader has to decide what next to do. Team leader has to make those calls. If in case team member feels that we are stuck up, we need to do something else, they can always raise a concern. I think so. आता आपण याला कार्डिओवर करायला पाहिजे. एकाने कोणीतरी सांगितलं ना तरी चालतं की आता कार्डिओवर करायला पाहिजे. आपण असं वाटतं मला पल्स आहे आणि पल्स बघताना शॉर्टकट नाही मारायचा. असं बोलतो पल्स नाहीये, पेशंट हलतोय, बोलतोय, श्वास घेतोय आणि कंप्रेशन केलं तर कोणालाही ते टॉलरेट होणार नाही. ठीक आहे. ओके, चल.